Thanks for coming to my session, everybody. I'm Molly McLeod. I'm a 2014 Coach America Fellow working with the City of Long Beach, working on healthcare projects. And right after lunch at 1:30, you'll hear from the Long Beach team and the rest of the health team at Coach America about some of the health projects we're actually working on here. But this morning, I'm going to talk about design and health. I'm going to start by talking about health literacy and why it's really important. And then I'm going to give you some basic design tips. And then we're going to do an activity where all of you are going to work in partners to do a critique and teardown of this flyer. So a teardown is just deconstructing something and to better understand its different components and think about how it could be better. So I'm going to have you all kind of work in partners to talk about how you might improve this flyer, and then I'm going to be redesigning it live in Microsoft Word based on your feedback and advice. So if that sounds good, we can get started. So I'm going to start with a story. So as a designer, I can't help thinking about how things could be better, whether I'm looking at a movie poster or a website or a sign on the street, or no matter what I'm looking at or interacting with, I'm always thinking about breaking it down into its different components and thinking how it could be a little bit better designed. And a few months ago, I got my first ballot as a California voter, yay, and with my ballot came this pamphlet. And so there's a lot of important information here, but it's a little confusing and a little hard to understand. So let's do a quick teardown of this and kind of break it down and think about what's working and not working here. So to start, I really appreciate that it says that there are a few easy steps to voting. I appreciate that somebody was thinking about that, but it's a little confusing because the steps here don't exactly follow or correspond to the information that's actually here. And it's a little confusing because using blue or black ink, I wouldn't really consider a step, it's more of a tip, so it's a little confusing. And then this information here isn't super clearly organized. There aren't very clear headers, and the information is a little bit scattered. So it's a little hard to follow, and it's not clearly organized. This information here I think is really helpful. It's nice to be able to see these different ways that you're supposed to fill out your ballot in the context of the ballot. But all the different kind of arrow styles also make it a little confusing to look at, and there isn't a clear hierarchy. So it's a great idea, but there's a little bit too many styles going on here. And then at the very bottom here is this information that was really important that I almost missed. So when I got my ballot, I was really busy and I didn't finish filling out my absentee ballot until Election Day, and I almost missed this note at the bottom that said I had to send in my ballot 5 days before Election Day in order for it to get there on time. I couldn't mail it on Election Day. So my ballot almost didn't get counted because I missed this note at the very bottom. And so a few minutes before I left work to go drop off my ballot at the polling place, it took about 10 minutes to think about how to redesign this pamphlet. So what I did first is I put the information that I wanted first, which was where and when to vote and how to drop off my ballot. At the very top, I made that really big and clear, so those dates and deadlines and instructions were right up front, and then moved the information about filling out your ballot below. And I kept the same idea of putting it in context, but I decided to kind of clean it up a little bit and try to make it a little bit more clear, and I put the write-in information kind of in context with the ballot. So I did this in just a few minutes just because I wanted to demonstrate how this information could be a little bit better. And design isn't just about making things pretty. I chose a nicer looking font for my ballot, and the font is prettier to look at, but more importantly, it's more readable. Design is really about how things work, and if something is well designed, you shouldn't even have to think about how to use it. It should be really clear and really obvious. And as you are hearing about throughout the summit, design is really important in all aspects of government and civic design, from voting to school registration to paying your court fines. But today, what I'm going to focus on is health, because bad design kills people. I know that sounds really dramatic, but it's true. If an ambulance driver can't find the house that she's supposed to go to because the satellite navigation system is poorly designed, or if somebody misunderstands the instructions on their medicine, or if somebody fills out a form incorrectly because the instructions are really confusing, that could be a matter of life and death. Design can also make a difference between somebody struggling to get by and getting the information and services they need to have a decent and dignified life. But part of how we can prevent bad design from killing people is focusing on health literacy. Health literacy is the ability to find, understand, and use the basic health information needed to make everyday health decisions. And it sounds pretty simple. It shouldn't be that hard. But actually 9 in 10 Americans have limited health literacy skills. That's most people. That's a lot of people. That means that most adults can't use a body mass index graph to understand what their healthy weight is supposed to be, or read a vaccination chart to understand what vaccinations they should get for their family, or even understand a drug label. And older adults are more likely to have limited health literacy than younger adults. Hispanic and Latino adults are more likely to have limited health literacy than white adults. And people who already have poor health are more likely to have limited health literacy than people in good health. This is a really huge problem, but it doesn't have to be this way. So what can we do as civic designers? Well, can start by writing in plain language. Plain language doesn't mean just dumbing things down or taking out words, but it just means using really clear and understandable information that anybody can read. And I'm not going to focus too much on content in this presentation, but it's something I highly encourage you to think about. And you can look at the Center for Plain Language, and there's lots of other resources out there for thinking about how to incorporate plain language into your content. But what we are going to talk about is designing clear information. So before we go into our activity, I'm going to give some basic design tips for anybody. So how do you get from looking at something and maybe you know and recognize that it's not well designed and you can critique it, but how do you get from there to actually making it better? Well, before you even go about the actual act of creating, before you even open your computer, there's a few questions you should be asking. First of all, your audience. Who are they? What are their needs? What languages do they speak? Where are they coming from? Hopefully you're hearing a lot at the summit this year about user needs, and I cannot stress this enough. So always think about who your audience is and what their needs are. Second of all, what are your goals? What's the most important information that they need to know? And what is your main message? You might have a lot of information that you think is really important that you want to get across, but if somebody could only remember one thing from what you're trying to say, what would that one thing be? What are your underlying goals? And third, how should this information be organized? What's the order in which they need to know it? How can you clearly guide somebody through the information you're trying to present in a logical order? And finally, what is your call to action? What does somebody need to do next? Do they need to pick up the phone and call somebody? Do they need to submit something? Think about really clearly what you want your users to do and make sure that that's very clear. So once you've thought about a few of these things and you open up your computer to start designing something, the first thing I usually start with is choosing a font. I will admit I'm a huge typography nerd, and so this is always my favorite part of a project. So a lot of these fonts here are the system fonts you'll find on your computer, but a lot of them are kind of hard to read. The two main types of fonts are sans serif, like Helvetica above, which has kind of flat edges, and serif font, like Times New Roman, which has kind of the extra little bits on the edges of the letters. And Comic Sans is commonly hated by designers, but I totally understand its appeal because it's really friendly looking. It's a lot friendlier than these other fonts. And I would recommend, if you have any doubts in choosing a font, sans serif fonts are typically easier to read. Calibri, which is also a system font, is a nice alternative to Comic Sans because it's still friendly and rounded looking, but a little bit more professional. And these other fonts listed here are free fonts that you can get on the internet. And when it comes to font size, make it really, really big. These are font guidelines that are generally more for print, but this goes for the web too. Make your fonts really big, really readable, at least 12-point font for anything on the print, and usually 16 to 18 for anything you're doing on the web. Anything smaller than 12-point is going to be really difficult to read. Line length is the number of words per line, and if the line length is too long, it's going to be really hard for somebody's eye when they get to the end of the line to go all the way back to the other side of the paragraph to keep reading. So make sure your paragraphs are kind of nice and short, and people will be able to read it a little bit more easily. Line spacing or line height is the amount of space between the lines in a paragraph. And the default line spacing is really tight. And if something looks overwhelming to read, people will be less likely to read it. So make sure to add a little bit of extra space in between your lines. Hierarchy is how you kind of guide somebody through your text, and you want to make sure that, that people's eyes have a really clear path to follow. And so if there isn't any hierarchy and everything looks exactly the same, it's going to be really hard to follow. But if there's too much and you have too many different fonts and colors and sizes, that can also be really confusing. So typically my advice is to go with no more than 2 fonts or 2 colors or 2 sizes of text. Keep it really simple, make the text a little bit smaller at each header level, and yeah, just keep it as simple as possible while still having a little bit of structure. In terms of layout guidance, this is very generalized because it tends to depend what kind of thing you're working on. But generally, if you have text and images kind of all over the place, and you have lots of things that you're highlighting, people aren't going to see any of them if there's too much going on. And if something is very text heavy and you have like a lot of tips and a lot of calls to action, that's also going to be pretty overwhelming. So generally, you want to keep it to one main strong image and one really clear message, and keep it as simple as possible. So to summarize this, go with sans serif fonts, makes your text really big, create a clear hierarchy and a clear path for people's eyes to follow, make a nice short line length and a nice wide line spacing, and in terms of your layout, just keep it simple. So any questions before we go on to the activity? Yes?
I'll use the term civic designer, which I've never heard of. But if I wanted to bring one to my agency, like, where do I find you guys? And what educational skills that am I looking for?
Hire some Code for America fellows.
Yeah.
I'm required to say that.
Yeah, I mean, talk to anybody at Code for America. You know, if you have a local brigade where you live, there's probably lots of folks in your brigade who are excited about helping. And I did use the term civic designer just generally, but it's not necessarily limited to people who are graphic designers or visual designers. I think a civic designer is anybody who wants to, you know, improve civic design. So I think you all in this room are civic designers just for being here. Yeah. Thank you.
I know GDS has their slash design principle. Do you guys have that one for Code for America, like slash design principle?
Alex?
We have no we have no laundry list of our specific design principles, but we do borrow heavily from GDS, and we also have some key capabilities that we believe governments need to work by the people for the 21st century, and those include designing for and with people. So you can check that out on our webpage eventually.
That's it.
Thanks.
GDS is good.
GDS is great.
Yeah.
At the bottom of the flyer, usually sometimes you want to put like connections to social media or websites. You know, what's some of the best ways to put that information, or just
I mean, it depends what you're trying to communicate. If it's just a general flyer, I would recommend keeping it simple and sending them to, you know, for example, if you have your social media on your website, maybe just sharing your website, because if somebody's just looking at a flyer, you know, they're probably not going to check out every link or do everything, or I feel like it's less likely for people to connect with social media via a flyer. So if you have kind of one channel to direct them to, like maybe your website, and then you can have your social media on your website, so send them to one place. Does that make sense? Yeah.
Yeah, within the sort of context of civic design, I'm wondering, particularly given your voter redesign, which was like really good, how it could be better institutionalized the feedback from the audience, such as yourself, that would improve it, you know, assuming it's less than optimal to begin with.
So you're asking how people can better solicit feedback on their designs, or?
Yeah, exactly. How civic designers could better get audience feedback in order to refine their design.
Yeah, well, I didn't touch on this too much in my presentation, but I would say, just to do even some basic user testing, which, you don't even have to get feedback from somebody who's an expert designer, but if you just show whatever you're making to somebody who's going to be using it, somebody in your community, you can even go to a grocery store, wait in the lobby of somewhere and just, take and say, hey, hey, do you have 5 minutes to give some feedback on this? Because, somebody who's going to be, using whatever you're making is probably the most important person to get feedback from. So I would say that that's probably the best start.
And a really good resource just for folks in the room is the civic user testing groups that Chicago piloted. And Chris Whitaker, who has worked on those, is a really great resource for that. All the Code for America fellows know about this. And they actually came up with a website and resource just a few days ago, I guess to launch with the summit. It's called Civic User Testing, and they, if anyone has questions about that, they can talk.
Thanks, Alex.
Yeah.
Anything else? Yeah.
So 2 things. Number 1, Smart Procure is hiring if you want to move to Florida. Number 2, if we have pamphlets after this, are we able to show it to you and see what your thoughts are?
Sure.
On it?
Yeah. Tweet at me or email me.
Okay.
Yeah.
I don't know if you're going to go into this, but so I'm an epidemiologist, and I just don't know what normal people understand anymore. It's been so long in my life, so I struggle a lot with should I use a bar graph or a pie chart, or do people understand 1 out of 5 better than they understand 20%? Like, are there ways to? Is there anyone that's really done broad studies of not just the design, but the content itself, and making it in ways that people understand best?
Totally. Yeah, actually, a great resource that I would recommend is the company that I used to work for is called Communicate Health. They specialize in health literacy and plain language and a lot of the things I'm talking about. So on their website, which is communicatehealth.com, they have this really great kind of resource and newsletter called We Heart Health Literacy. And there's this archive of posts about exactly those types of things. And they have all these posts about numeracy and how people understand different kinds of images and different kinds of content and different words. So there's a whole archive of that, and they send that out kind of as a weekly newsletter. So it's a really great place to start, and they have a lot of research about that as well.
Do you see Civic Quarterly becoming a vehicle for getting that type of content kind of catapulted into a medium that's more that journal look and feel that folks who have this more traditional FE background will identify with a little more and can show to their decision makers? I mean, this will be just totally assuming, correct me if I'm wrong, but sometimes when I have something that looks scholarly and journalish, my decision makers will be like, ooh, yeah. And so, do you see that, having that content available on a website is super awesome. Do you see that maybe some of that stuff might make its way into things like Civic Quarterly?
Yeah, I think so. Civic Quarterly is a new publication that I started with a number of other Code for America fellows. And we're giving out copies to everybody at the summit. I have some here if you haven't gotten one yet. And I wrote a whole story about my ballot redesign, and there's lots of other great stories in there as well. And so we are hoping to do kind of more longer form, more thoughtful content about the civic design community and the future of technology. So we hope that will, and all of the content is, it looks beautiful in the magazine, but it's also all available on our website too, which is civicquarterly.com. So yeah, hopefully that will be a great way to share some more of these stories. Okay. Maybe one more question, then we can move on, unless anybody doesn't have a question. Cool. Okay. So now it's teardown time. So I have this flyer here from the city of Long Beach. I was chatting with the health director in the city of Long Beach, and this is one of the flyers that they helped identify as something they would like to redesign. So I'm going to pass these out to everybody, and I would like you to chat with a partner or people at your table for 5 to 10 minutes. And really think about some of these questions that I talked about. Who do you think the audience is for this? There's a lot of content here, so what do you think the main message is that they're trying to get across? How could the information be a little bit better organized? What's the main call to action, and what would you do differently? So feel free to, I have a bunch of copies of this, so feel free to draw on it. I have some blank paper too, cross things out, kind of sketch a few things. So I'm going to give you 5 or 10 minutes to do this, and then we're going to come back together, and I'm going to collect your feedback and try redesigning it. So one of the things I want to also demonstrate here is that I usually use Adobe Creative Suite. I love InDesign and Illustrator and Photoshop, but you do not need any fancy design tools to do this type of work. You can do actually pretty good design in Microsoft Word, and that's a whole another workshop in itself. But I wanted to do this in Word just to kind of show you that it's possible as we're going. And you know, we only have about 10 minutes left, so we're not going to get too far, and we probably won't be able to incorporate all of your ideas. But I want to just kind of, you know, quickly gather some of your ideas and kind of see how we can put them together. So to start off with, we can just do this maybe kind of popcorn style a little bit. Who do you guys think is the kind of the key audience for this?
Mothers.
Young family.
Parents.
And what do you think, so I created this is just a document that has all the content in there, but I think we can strip it down a lot. So I'm going to start a fresh one. So what do you think, what is the information that absolutely has to be on here? What is the most important content? Free. What else?
The eligibility requirements, the number, and the phone number.
Which number? The phone number? Okay. What else?
What's free? Like what services? What's included?
What's included? Okay, so we've got the numbers, we've got the free, what it is. What else do you think should be on here? There's a lot of stuff on here.
Where are the checkups?
Where? Does it say on there?
No.
Okay. Well, we don't have that information.
What's included?
What's included?
What it is health checkup.
It's a health checkup.
Well, I think that's the benefit. To me, it's why they should be doing this.
Why?
If you were thinking of like the help children and teens stay healthy, find health problems for it. That's what I would call the benefit.
Okay, what else?
Well, we would throw everything else out.
Okay, great.
Or because it's confused as to, are you trying to get people to enroll in Medi-Cal?
Uh-huh.
Or are you trying to get the health benefit?
Yeah.
So, I mean, it's really maybe throw it out or put it on the back page, something like that. But I think we should have they should have the little detail of like, what the health checks include.
What the health checks include. So this bit here is good to know. Okay. So that should be on there. It doesn't need to be super prominent, but I agree that it's probably good to include, you know, to show what this actually means. So that's good.
How do you get it? Like, what's the next step? How can I go ahead and get this callback?
Do you think that would be these phone numbers here? I mean, that's all that's on there now.
Right.
Well, we assumed one of the phone numbers because they're probably next door to each other. They could refer to if you get the wrong number, they're right. They're the next desk over.
Yeah, hopefully. Yeah, I think there should only be one phone number. No?
Totally different people. Probably not even in the same agency.
It's totally different, but you know, if I get that they're totally different, but if you're trying to read the flyer, you're going to get it wrong. Most people will
Yeah.
get the wrong one. So why confuse them and still have them do it wrong? Why not just?
Yeah, so maybe, I don't know exactly the difference between these two, but maybe they need two different flyers if they're two different, you know.
Totally put them on different.
I think we could share that during the health checkup if they would get more information
Mhm.
on insurance programs. I mean, clearly they want people to get in the door.
Mm-hmm.
But this is for the,
Yeah, but that's
this
too
is
much.
for CHDP, not for Medi-Cal. So I think the other phone number is the right one.
Well, one is you qualify, and the
Well,
other is you
obviously
don't
this is-
qualify, but insurance might cover.
Exactly.
But this for CHDP checkups.
Yeah, so
Not for a
this
Medi-Cal appointment.
so this seems to be the number that this particular flyer is about, and then this is just bonus. This one. Great. Cool. Let's just do that one.
The language is not a real issue, because it says call for a list of doctors.
Yeah.
Schedule your free checkup.
That is confusing. How about we just change that text and make it really big because it's the call to action. So
Call and you don't qualify.
They'll tell you and call the other number.
so what do we
That's why our
Is there an order thing to think about? Like, does the phone number go? What should go between the number and the message up top?
eligibility.
Picture.
More
Picture.
clipboard. We don't have enough.
Definitely a picture of
Rotating
some sort.
chip.
Make it friendly.
yeah, make it friendly. Show a happy family or something.
We
So
need a picture with a doctor and a kid. Like, there's a lot of templates for that.
yeah.
Yeah, definitely.
So what are we changing the call to action to here? Why are you calling this number?
To schedule your free checkup.
Schedule your free checkup.
Well,
Maybe.
it's to find the doctor, to give the number to the doctor to schedule the checkup.
But ultimately, I mean, it's to schedule your free checkup, right?
Yeah, they might not need to know that. They might just, this is
Simple, yeah.
Yeah.
Just put in the word now, just because that.
for urgency.
Be, like there are more conversions with that, but that's just me. The word now.
Where would you put it?
Just schedule your free checkup call now or things like that.
Call today.
Yeah, I like that.
Call today.
From 9 to 4:30.
3:30 in the morning.
Schedule your free checkup now.
Like,
Schedule your free checkup now.
But if it's lunchtime, I mean, in consideration of what these ladies were saying, if it's lunchtime, you might not be actually able to schedule your appointment because the doctor's office won't be taking calls. You can get your doctor's number, so maybe leaving out now might help kind of, I don't know, not mislead, not that it would be misleading, but you may not be able to schedule if you call that number now.
You're not gonna be able to schedule when you call that
Yeah.
number. You can't, because you're calling CHDP to find a doctor.
Mm-hmm.
So this is why this flyer is this confusing, because the system is this confusing.
Mm-hmm. There you go.
maybe this flyer will.
Maybe to find a participating doctor, call this number. That's what you call it.
To find a doctor.
But then people are gonna call up and say, I wanna schedule an appointment, and then the person's gonna answer, well, sorry, I don't schedule appointments.
But you
I'll
got
give
on
you
the
the number
phone.
to the
That's
doctor.
good news.
That's conversion.
Yeah,
That's
right.
conversion.
Why is getting on the phone
Yeah.
goodness if it doesn't actually
Yeah.
solve anyone's
Yeah,
problem?
to find a participating doctor.
Well, then
Find your
people
doctor now.
answering the phone
Call.
change their.
Yeah, I
I don't know if that builds trust though, when you
Yeah.
call and you don't get with the service that you expected. That says right on the flyer.
So
then the designer can call them
Okay, let's come back to that text. Anything else that is there anything else that actually needs to be on here? We can throw a nice picture of a kid and a doctor or something. But do we need anything else on here?
Well, it doesn't say
Eligibility.
I put
Do people know what the
Who's eligible?
CHDP is? Like,
Yeah.
that's something
I don't know
that's
what that
generally.
Not targeted have one.
Can you take down
And
the
do people
CHDP?
care?
Here.
We need, so we were talking here, we need something that confers some level of authenticity that this is a real program.
Uh-huh.
So the logo that we had on the original one, that this is not just some
Yeah.
fly-by-night group.
Right.
This is the city of Long Beach.
Is that where the help?
Oops. Yes. Yeah. So the city of Long Beach actually is only of one of 3 cities in the state that has its own health department. So yeah, the logo adds some nice authenticity to it. If I can figure out how to reposition it. Text through. And I think we should put it in the bottom corner instead of, at the very top. Probably.
Just put just questioning that why to build credibility instantly, why not in the top right, why bottom? Like, why do you leave it till the end? Just questioning the stuff.
Do you guys have any thoughts on that, or do you want me to answer? Anybody else want to? Okay. So I mean, I think it's because it's not something they need to see right away. I mean, when they're first looking at it, when they're first seeing it, free health checkups, like that's what they need to know first. And then, as they get the information, then they can see at the very bottom that, this is a legit thing. So I think it's like, I mean, it is important to have that authenticity on there, but it's not the very first thing people need to know.
Maybe it's like at the risk of distracting from the message. So, I mean, does that happen? Have you guys found that when you put too much stuff on top, it's just going to distract people from being able to even really get started?
I think so. I mean, we could just add some smaller text up here that says, the City of Long Beach provides, maybe a little bit smaller. So we have some text up here that has the city right up front, but it's a little bit more subtle, and it's not, a big flashy logo is like the very first thing. You probably don't need that. But we could add some text maybe that says that. All right, just City of Long Beach, a little small. Not that small. Can put it in line or box or something.
So you don't think you need to have the eligibility on there?
We could.
Because it's only for people who are low income.
Right.
And you get,
Or minute.
yeah.
So where was that? So this information here is probably important, right?
Yeah, and the no documentation is important.
So where on here do you think that should go?
Probably under the babies, children, and teens.
Up here?
We were thinking of putting it after the benefits or
What do you guys think?
Well, is that eligibility for the free health check or is it for Medicare?
For the check. The Medi-Cal is it? I don't know if you need the Medi-Cal information.
Right, because that's different, right?
Yeah, the bonus is just a different program.
So this is just for the checkups.
I would be disappointed if I weren't low income and I read about all this really cool stuff I could get, and then oh man, I don't qualify. I'm gonna have to go figure out how to get that another way.
Back to like the top of the screen, they'll tell you if you're not, here's what, it's the right half of the old form, that most health insurance provides these services.
Can it just be for low income babies, children, and teens?
Yeah.
So incorporate it here.
Yeah. I don't, but it's just already said.
As opposed to a high income.
Well,
Yeah.
what if it was just
For low income families.
low income families?
Babies, children, and teens.
But just having the bullets, who's eligible,
Yeah.
and here's what you get.
But
And
you
then-
definitely need the no documentation.
Yeah. Oops. Word is such a pain.
I think PowerPoint's a little easier.
Yeah.
It makes things like this.
There we go. All right, this is looking a lot better already, I think. Sure. Actually, well, I'll have to add that post production here because I don't think I'm connected right now. But we definitely will add a picture. Okay, in respect of time, I want to kind of wrap up and let you all go. But I hope this was helpful. I will, yes, questions?
One last question.
Sure.
And I was going to ask it earlier, but this has proven it. No, in terms of design, does democracy hurt or actually build design? Because everyone will have their own opinion. We want to add a party and a path. But then it'll take away from sort of the message and even delay stuff perhaps. how do you build up? Does that happen a lot?
Yeah, that's a great big question. I would say, going back to what we were talking earlier, I mean, I think it's great to collaborate with people and get feedback from lots of different viewpoints. But I think it really does come back to having one person who's kind of the owner of whatever you're making, and it doesn't have to be a designer, or maybe it's a project manager or somebody who kind of can make the final decision. And I would say in terms of getting feedback and in terms of democracy, if there's any disagreement about information or something or design that should be on there, just test it. Test it with somebody, show it to somebody, being like, does this make sense to you? And so go back to focusing on user needs and just show it to somebody instead of design. Design by committee like this can be hard, but if you show it to somebody who is not part of the process, but is somebody who's going to be the end audience and get their feedback, that's probably the most important. But that's a great question. Does that make sense? Yeah.
Sometimes we also show different mock-ups to groups, which can be helpful. I feel like this does work really well.
Like different design styles.
Any other final questions or comments? Feel free to, I would love your feedback on this because it's something that I've done a little bit before, and I would like to continue sharing this information. So if there's anything that was really helpful or anything that didn't work for you, please let me know. And talk to me if you want feedback on your designs. And thank you for coming.
Thanks,